Chantal Ambrose, and I'm a dentist, and I host a healthcare business podcast that shares tips from the healthcare industry leaders. So, whether you're a startup or needing a push in the right direction, a family business, or just looking for mentorship, join us. Today, we have a very important guest, and something that's again very close to what I like to advocate is proper oral health care requires quite a lot of sophistication and expertise. And today, to answer all of our questions, is the president of OHASA. Now, I want to tell you a little bit about the president of OHASA. She is Anri Bernardo, and she is situated in the Western Cape. She has an amazing amount of skills, and I am very excited to actually have her on board. So, welcome, Anri.
Thank you. Thank you, Doctor, for the opportunity on your platform. I really appreciate that.
So, listen, we met when you invited me to speak for ethics at the Hasa National. And the one thing I do speak, and I have spoken for over 13 years at many organizations throughout the country, and I've been lucky enough to interact at that level. But I'm most impressed by Ahasa and your leadership and the amount of teamwork that goes in so seamlessly is remarkable. When I arrived at Ahasa this year and I met the team at large, it was almost like everyone talks to each other every day as though you guys are working in one day. And then I was so shocked here that every single person I'm talking to comes from a different part of South Africa. That for me is absolutely unique, dynamic. It shows really tremendous leadership. I'm really wanting to hear about us maybe sharing some tips about how are you getting that right? How are you getting everyone on board at that level of open communication all the time? So we're going to be talking about. I want you to first give us an idea, give the audience an idea of the roles that you are managing.
Being the president of an association is quite a big task. And I always say I'm not a dictator. So my first role is to support my team, because if there's no support of a leader, your team will just fall apart. So I do have amazing people working with us on the team. And one of my biggest roles is to chair meetings, make sure there's an ongoing planning process and communication process between myself and the rest of the team. And then very important as well, I'm very involved in the engagement meetings with our stakeholders and different universities, sponsors and traders, which is very important. And then managing a lot of emails, a lot of questions, a lot of email. But I cannot do it without my team. So we are a national expert team consisting of myself as the president. Then it is the president-elect, which is Cole Gilbert. And then we have a secretary, a treasurer, and we also have the immediate past president, who is Stella Lambrecht. And she has been part of OHASA for many years. I can just always pick up the phone and say, Stella, I need help with this. What do you think? Please advise, Then we have International Federation of Dental Hygienists representative on the EXCO. We also have our OHASA journal editor on the EXCO, as well as a CPD committee. So that part is very important, with the accreditation processes and things like that. And then we have our different branches as well with the committees. So communication is a very important part of this association. We have WhatsApp groups, we have emails, so we do stay in contact with each other daily. And Saturdays, Sundays, we just have to, because that is what makes the association and the team, is the teamwork and the association. And like I said, I'm there to support them and not to dictate them. And I think that should be a good leadership quality to have if you want to run something like this.
It's really remarkable because your leadership, there are different ways that people lead. And I think that when you're a part of your team and when your members actually see you as leadership that is able to cross-board stand, then sit at the top, give out commands, I think that it's very in keeping with what the current standard, best standard of management goes. It's beautiful to see, and I think you're doing it very well. very well indeed. And
Thank you.
I was blown away by your Congress. I really was. I had no idea that you had invited an international audience. Now tell us a little bit about the behind the scenes. Who was invited? How did you manage all of this? Because, when we host congresses, not all of us have an online platform where we now also having something live recorded where people are able to actually participate at that level. That was really amazing.
So, with COVID-19, I think for a lot of people, it was a devastating time. But there was also some stuff coming out of COVID-19 that was a positive thing. And that is where the virtual attendees or where the virtual platform comes in on our association. We started making use of more virtual opportunities, webinars, to try and keep our association, our members together by still getting access to the latest knowledge and technologies and speakers that can present on a virtual and webinar platform. This year, we started last year with our first national conference at OHASA, and we are very proud of ourselves, because it was very successful last year. And this year we continued it to combine our annual general meeting with a national conference. So we invited all our members were invited. We invited non-members, which consists of dentists, dental therapists, dental assistants. But OHASA is also a member country of the International Federation of Dental Hygienists, in short IFDH. And the IFDH has 32 member countries, and OHASA extended their virtual invite to all of those 32 countries through the HODs of each member country. We were very lucky to have them all on the virtual platform. It was quite a big thing for us. Together with our members and non-members that also attended the virtual platform. So to plan a conference like this and including a virtual component, it's quite a lot of planning and admin, but we have a great team working together, and Cole Gilbert, who is the OHASA's president-elect, he's quite tech savvy. So we learn a lot from him, and each and every year we just try to build on that. But there's a lot of planning going into these national conferences, and especially when you have a virtual component because it's live. So you need to inform everyone, you need to get the speakers on board, you need to get the venue on board and all the technologically things that goes with that. But we are very fortunate to have that and to do that. We're definitely going to keep on doing that because it just broadens our area of where health professionals can join our association and our CPD seminars or webinars.
I really think that it is an exceptional triumph, and I really congratulate you and I congratulate OHASA at large and your team because it was really seamlessly pulled off. I know just from my experience is that it's not an easy thing to do, and to make it look seamless require a large amount of expertise, so super well done. Now, I know that you're involved in government healthcare, and I know that your heart is also about increasing that umbrella of oral healthcare communities, and that you're very interactive in universities and being able to now find a way to actually reach more people of where you are in a clinic currently and what the situations are like, and what you think could even help to make that situation a lot more efficient as it stands.
So for the past 8 years, I've been employed in the Department of Health Western Cape as an oral hygienist at a primary healthcare facility. And that is where my heart is actually coming from private practice into public health care, is the community health part of your profession, and which I really enjoyed and which I really love and have a passion for. I think currently at all across the world in our primary healthcare clinics, the main issue is understaffed and overpopulated. And when I say overpopulated, I'm referring to the increase of people making use of public services. Due to the country's current economic status and after COVID-19 especially, there is a big influx of people making use of the public services. But there's not enough staff. There's not enough improved technology to deal with the influx of people. And that is quite a sad part to see, because you always think of the future and where are we heading to? And if we don't have enough staff to treat the amount of people coming into your primary healthcare facilities, then that is going to become a big issue. So with the primary healthcare, my focus there is basically on promotion and prevention of disease, which includes my oral hygiene treatment and your fissure sealant programs, school programs, ECD programs, as well as assistance in other community programs by promoting oral health. And sometimes it is in areas where you don't have all the resources, but you try and with what you have. And I think for the primary healthcare facilities, maybe the private sector should also take hands with the public healthcare facilities and the government to say, look here, this is the improved technologies that are needed to give all the people the best treatment, and we need to take hands. I feel there's still quite a bit of a big gap between private and government, and we need to start closing that gap, because like I mentioned before, more and more people are making use of public healthcare facilities. It's not necessarily people that don't have jobs. It's people that do have jobs. They lost their medical aids. They lost their income during COVID, and they are now reluctant, or they now forced to make use of the public healthcare facilities. And not all public healthcare facilities are bad. Sometimes we see on television or you hear on the radio, this is what happened in this kind of facility, but it's not always the case. And it's because of the influx of people and the understaff and not enough resources available that we are starting to not get the best out of the primary healthcare facilities than what we should.
Yeah, I hear you. Just recently, in fact, I had somebody come to me and is part of the government health system. We've had heat waves out in our place, and so they were just describing to me during surgery. Remember, we have load shedding and an air conditioner that wasn't working in the clinic. So what has happened was that they had to continue, of course, in what was 42-degree heat. And the air conditioner was not fixed for the full 2 days, but the patient was sitting and waiting. And you must understand that you're not thinking that when you're going to the clinic, you can't be turned away, because, the perspective of people that are using clinics is that often they're making great sacrifices to get there.
Yes.
They actually wait a really long period of time before they get there. They have to think about transport costs, they think about family costs, they have to think about food costs before they get into the clinic. So you can't tell somebody that's been waiting in queue for days on end, sometimes months on end for surgery, that I'm sorry, your air conditioners are not working. So imagine now the staff working under those facilities.
Yeah.
It's not the same story in every hospital, but we have this increasing stress and burden because of the demand on the public system, as you rightfully say. Post-COVID, there's been a lot of job loss here, 40% disposable income. A lot of medical aids were no longer affordable by many people. They've had to drop their plans. And so when they get sick, they need to go somewhere. And so I hear you. And yeah, it is something that we're going to be talking about later on some of our other episodes. I appreciate that perspective of anyone that's in the system and telling us really what's happening. And we do appreciate that every single system is different. I absolutely agree with you. Some of the most amazing care comes from our government healthcare, and some of the most motivated and passionate professionals are parts of the government healthcare system in South Africa. So, yeah. What I also wanted to know, part of your role that you mentioned was stakeholder engagement and so on. Now, they made a large part of our congresses and our CPDs and how we're able to bring education to more people. So can you give us a little bit of a background now of these kind of relationships? How do you facilitate these relationships? Who are you looking out for? And how does it all happen?
So at OHASA, we are really privileged to have an amazing support and relationship with our dedicated traders. We always try to keep them in the loop with all OHASA affairs, and we invite them to engagement meetings because their voice is also very important to us. And since last year, we've actually introduced a platform where we meet with our dental traders or traders at large once a year in person to discuss any opportunities, any sponsorship opportunities, but also for them to tell us where can OHASA improve from their perspective, what can we do for them as a company, but in return what they can also do for the association and our members. And that is quite successful. We've done it this year again, and I can just say the opportunities is just getting bigger and bigger and bigger, and I'm quite excited about that. Unfortunately, I cannot mention any company names or so, but we do really have companies that's supporting us each and every year. And with their support, they just grow bigger and bigger and bigger for next year. And we're really looking forward with the engagements and the involvements for the next few years. We also try and always, open our door to any other company. It doesn't have to be a dental company per se, to come and join our association, to come to our seminars, meet our members, and to also share their knowledge and their involvement in OHASA. So I think that is something that we started last year, and it's quite successful. We do engage with our traders on a weekly, on a monthly basis. We are really, without our traders, OHASA cannot fulfill all its duties, and we're really privileged and grateful for them.
Yeah, no, listen, I really want to give a shout out to them because they really do facilitate our educational capacities in each organization that they able to support.
Yeah.
Yeah, I do think that they've done a fantastic job, and I think that
Yeah.
OHASA invites that.
Yeah, if I may just add, also since last year, we actually incorporated hands-on workshops in our national conference where some of these dental companies are really coming in, and that is a big part which we're trying to improve, to offer our members hands-on workshops. Because some of our members, as myself, I've qualified 11, 12 years ago, and you need to keep up with the latest technologies, and a lecture cannot always do that for you. And that's where the dental companies come in. And this year at our national conference, we had a laser workshop, and we have a guided biofilm workshop where the company comes in and they sources speak to give the theoretical component to the members, and then the hands-on workshop. So that is something that we're really looking forward to, and to do more, to collaborate with our dental companies to have more of these hands-on workshops.
Yeah, it's phenomenal actually, because the hands-on workshop, I was just explaining to one of our learners that, you can be a fantastic just academic. Once you go from that head that does not move that you're practicing on
Mm.
to the head that swallows and actually
Yeah.
is needing to move and needing to close and needing to salivate. The suction's not comfortable, but then the suction, then I'm gagging. Ball game. It is
Yeah.
another ball game. So the more hands-on that you get, the skill set becomes almost like a muscle memory. The start of that muscle memory that really gets you to that point of perfection in the career that we are in. You're constantly evolving. I'm very excited by some of the and digital supported oral care that we have coming in. I don't know if you want to touch base on that actually, because I see that there's some new products now that are available that I've just recently been looking at that does meet that digital sort of keeping up with the global standard of oral care, like laser, for instance. So how is
Yeah.
laser being used for oral hygiene?
Look, the scope of practice of oral hygiene is expanding, and there was an extension or expansion of the scope of practice twice already now, and we are looking definitely at a third one. It is lying at the health minister's on his desk. So once that's promulgated, members will definitely have to upskill themselves. And one of the things is laser treatments. And where the laser treatments comes in for oral hygiene treatment is your of the periodontal treatment of the patient, as well as whitening procedures. And it's stuff that's coming up now that we never thought that we would be able to do. But like I said, we need to move forward with the times. We cannot stagnate our own profession because this is only what our initial scope of practice said. We need to move forward with times, and that is why, like I mentioned, that's where the companies are coming in, and they really bring us the latest advanced technology so that we can broaden our profession. But I always say, for the oral hygienist or the oral hygiene profession, your main focus is still your promotion and prevention. So if you can include all the latest technologies and still have that in the back of your mind, promotion and prevention, then I think we are getting there. We don't want to stagnate as a profession. We want to grow it. Yeah.
Yeah, and that's what you definitely are doing. A couple, I think it was a couple years ago that we've become more and more available of private oral hygienists in private practice,
Yeah.
and I always touch base with that, and um, I know that when you go into private practice as an oral hygienist, there are a fair amount of tips involved and things that you need to know about. So what tips do you have to any of the oral hygienists that are listening out to us today? What sort of tips do you have before they go into private practice? So if they're wanting to make that move into private practice now, do you have anything that could just give them in terms of advice?
Yeah, I'm just thinking on back the time when I started fresh from university into private practice. I cried for 2 weeks because it was quite a shock.
Mm.
And you need to go in with that mindset of you're going to be busy and you're going to see patients. It's not like you will see a patient, um, you know, only one or two patients for the day. So it's quite a big shock, but you need to discover yourself and you need to go in with an open mindset and you need to be open to change. Not every practice is the same. But you as an oral hygienist going out there, you need to know who you are, and no one can take away your qualification from you, and you need to be confident. You're going to make mistakes. Don't hide your mistakes. Um, Keep moving forward and learn from everything. If you do make a mistake, learn from it. If a colleague is giving you advice, whether the colleague has qualified 20, 30 years ago, listen to that advice because you can maybe learn something from it and make connections. Please don't live in silos. And that is where OHASA is coming in, where it's really the platform for young oral hygienists just coming out of university now into private practice, which can be very daunting to make that connections at OHASA, to get that support. And that is also what OHASA is there for, to give you the support. And then I always say, be patient with yourself. And most importantly, treat everyone, including your patients and your colleagues and yourself, with the utmost dignity and respect. Then you will thrive. Yeah.
Well, those are great words of advice. I think you could take that being in any part of the health profession that we have in our listenership. So I really am grateful for that. Do you have any educational groups and communication structures when you're a member of a HASA that you're able to benefit from?
Yes. So we always promote OHASA as not only CPD, yes, but we do have a lot of CPD seminars. So currently how OHASA is run, we have 4 different branches in the Western Cape, Gauteng, Eastern Cape and KZN under the national umbrella. So all of these branches plan their CPD seminars And then national also comes in, and we plan the national conference, as well as we have quite a lot of webinars partnered with different stakeholders and companies. So there's always a lot of opportunity for our members to engage in these educational seminars and webinars. And then we also have an amazing OHASA journal. And we've been trying to get this journal accredited for years now. And the only way how we're going to get that accredited is if oral hygienists start writing up their cases and start writing in these journals. So we really encourage our profession, our oral hygienists, to get out there, write up your cases. It can be something small, but just to start with that, to put in our journal. So in our OHASA journal, we also have CPD questionnaires, where the members can also make use of that to earn their CPD points. On our current website, we have a knowledge share section as well, where members can share knowledge with each other and do a little bit of a discussion around, say, for instance, a specific topic. And I can say that now we're very excited. We are launching our new OHASA website on the 1st of January. And yeah, we gave our members a little glimpse of it at the AGM. And a very exciting part of this new website, it's going to be public facing, but health professions facing as well. So the public will also be able to go onto our website, our OHASA website, and learn about tooth sensitivity, learn about bad breath. So we're very exciting about that, and we want the members also to get involved in that. And then we on a regular basis send out communication to all our members via emails, social media, website, and journal. So we are really trying to get our members involved in educational programs and planning that for them as well.
That's fantastic. I think that it's one of the greatest strengths of OHASA is that the collaboration that happens there is really quite exceptional. It's extremely exemplary. I'm wanting to know, just in terms of what do you think, where does the future of oral hygiene in South Africa lie?
So, as I mentioned earlier, if you look at the oral hygiene scope of practices that are being expanded and going to be expanded maybe for, another expansion or another 2 or 3 expansions, oral hygiene is really moving forward with the latest evidence-based treatments and technology. And with independent private practice coming into effect a few years ago, the oral hygiene profession really has a big opportunity to build our profession and to not let our profession stagnate. So I really think the future of the oral hygiene is bright. It's just we as clinicians need to upskill ourselves regularly so that the profession does not stagnate and that we move forward with times.
Okay, now, listen, I've been speaking to a lot of people in these power positions, and I know for a fact that it is difficult to chair meetings. Now you're working, now you're running still at home, you're still needing to go and, communicate with all of the different national organizations. Then, you're engaging with stakeholders, and, it is quite a tremendous amount on your shoulders, even though you're looking so calm and cool and collected. So, do you have any tips? How do you keep this balance going?
I'm 33 years old only now, so I know a lot of people say, enjoy your life. But, when you make a decision and you are dedicated to something, you are dedicated to something. And I've learned through the years that you need to take one day at a time. Yes, you must have goals. You can have a 5-year plan, but tomorrow and the future is not guaranteed. And that is why you need to take one day at a time. And I can have my list, but each day, tomorrow will never turn out like I planned it or I wanted it. So you need to wake up in the morning with that mindset, I'm going to take on today as it comes. And you need to have a very good supporting structure. I'm sure, Doctor, you as well, you can vouch for that. If you don't have a supporting structure at home with your family and friends, it can become quite lonely in our professions, as well as being part of such a big organization. And like I said, I have the most amazing support from the team that I'm working with, and my family and friends. When they ever hear the word OHASA, they know I need their support now. Yeah. And then I say, you need to take the first sip of coffee in the morning. I love coffee. So I've always, you need to embrace the aroma and the quietness of that first sip and just set your mind for the day. That's what I'm trying to do, yeah.
Well, you're doing it very well. You're doing it very well. I commend you. I am so excited. If at 33 you are already the president of OHASA, I don't even know what you're going to blow us away with in the future. I wish you all the luck. I think
Thank
that
you.
you must be very proud of the accomplishments that you've made. I truly mean that it was one of my favorite congresses this year, and I was very privileged to attend. So thank you for all that you're doing for education in oral health care. It is really great work for you and your team. Well done.
Thank you, Doctor. Thank you for being part of us, for being part of our profession as well. Really appreciate that.
We have covered starting up and how to turn your vision into a business. And in our future episodes, we look at leadership, we look at multi-practice success. Now, I'm grateful for you, and I would love to hear your ideas. What questions do you need answered? Please drop me a mail at behindasmile2@gmail.com. I look forward to hearing from you, and remember, you are heard, you are seen, and on this platform, you are invited. Let's make it happen together.